thinking of getting some sun in South America, how about a little nip and tuck while you're there? Well, plastic surgery, of course, is on the rise around the world, and many are flocking to Colombia for their procedures. Here to tell us more is surgeon Dr. Alfredo Hoyos. Now, you specialize in high-definition lipo-sculpture. What does that involve?
Actually, that is my invention. Is what we call an advanced type of liposuction. It involves two things. One is a technology that is called Vaser, that is literally something that can make you have a more artistical job. And the other one is a technique, that is the one that I created. It involves to have differential liposuctions, which means that we have to do superficial and deep liposuction in order to get a more athletic appearance in the patients.
So how are you able to achieve high definition, as you just described, in someone who wants to have a six-pack?
Well, that's a very interesting question, because there are people who are considered very good patients for doing liposuction. This liposuction is different because it can be done in people who are not very perfect candidates. So, for instance, a person who is very athletic but doesn't have the six-pack can have now the six-pack through this. And a person who is very slim, we can actually achieve a more athletic result as well. And of course, in people who have like a little bit more kilos extra, we can take some out and we can do a little bit of definition.
So there's obviously limits to how much success a patient can achieve.
Yes, of course. The idea is that we can do this in regular, normal patients. The idea is that not extremely overweight, not extremely obese patients, and not in patients that have massive weight loss patients, for instance. And the ideal is to have very healthy patients.
So what then happens to a patient who puts on weight after the surgery?
Well, that's very interesting, because if you have a very athletic job, the idea is that people tend to conserve it over time. Usually when you see the six-pack and you are actually very fit, you go to the gym and you start like a new trend of life. The thing is, this is what we call a dynamic surgery. It's not like a nose job that you preserve the shape over the years. This is dynamic in the sense, if you eat, you get to lose the results. If you don't eat properly, well, you get lost them over time.
Now, I have to assume that many men are having this surgery. They're the ones that, like the six-pack on their abs. What else are men getting done?
We have an increasing perception of beauty and preservation in men as well, something that we didn't have before. So men actually want to get more healthy and look younger as well. So they want to have the six-pack, for instance. Usually what we see over 40s or 50s, they try to have like a bleph done, take out the extra skin on the eyelids, usually nose jobs. These are like the most common surgeries that we do in men.
With respect to women, of course, breast implants seem to be all the rage, but PIP implants really came under fire recently, scrutiny being that, these French-made implants in some cases were rupturing. When a woman is deciding whether she should have this surgery, what should she be keeping in mind when she's shopping for the right surgeon?
There are two things that you have to have in mind. First, to have a board-certified surgeon. We have to have very good training, and we have to keep updated in the field. So usually a board-certified surgeon knows what is best for you. The second part is specifically about implants, and the main thing that we have to have in mind is that they are certified as well. Usually having an FDA approved and CE approved actually help us to have a little bit more relief in that sense.
Dermal fillers now are kind of the wild, wild west of the cosmetic world. It's so enticing, the idea of just being able to snap your fingers and reverse time. But there are some complications, of course. Can you tell me, how can someone decide what is the best type of filler to use if they want to achieve the results and still be safe?
When you put a filler that is permanent, you can have also permanent complications. So usually what I recommend is to have temporary fillers, something that is resorbable. And specifically hyaluronic acid, that is the one that we promote more, because it has very proven safety, is effective, and over time just goes away, usually in a period of a year, or nowadays almost 2 years. But the main thing is that the patient can choose what he can or she can be done later. If you say, oh, my cheeks were too high last time, let's put a little bit less next time. So it has these two advantages, that if you have a temporary complication, it's gone in some period of time, and you can actually over time choose the best way and the best places to do it.
Now, Colombia, of course, is one of the most popular countries to travel to for surgery. But if someone is trying to decide, don't you think they should rather go with a local expert versus someone who's overseas?
Usually the experts are not just in one place. So usually if you want to find an expert in the face, you go wherever you want to go to have the surgery with this specific person. In the sense of Colombia, we have one of the safest and more advanced fields in plastic surgery in the world. We have the expertise as well. And the government itself is promoting to have medical tourism. So we're building new hospitals, new clinics. Everything has to be board certified. So I think the government backup is very important for us as well.
Do you think that South America is ever going to shake that reputation that it is somehow a cheaper alternative to seeking out surgery in, the Western world?
I think it's a slow process because you have alternatives that, because of the economy, are actually cheaper than in first world countries. But I think slowly what we are seeing is that the patients are not coming because of having cheap surgery, but they are actually seeking for the best surgeon to do the job. People are getting aware that when you do a surgery, sometimes it's something that you have to choose carefully and rightfully in order to get the best result.
Dr. Hoyos, really, that was such a fascinating conversation. Thank you so much.
Thank you very much for the invitation.